there's still a lot of discussion about what are the practical steps it will take to get more value from the $2.8 trillion that America is spending on healthcare this year. And the pressure is on because the government estimates that that 2.8 trillion will rise to 4.8 trillion by the end of the decade. And so the question is, how can changing the information and the incentives that are available to doctors and hospitals and us as consumers, how can that bring about this improvement that everybody wants to see?
Tell me a little bit about that. How would that work? When you're talking about moving away from fee-for-service, what are we moving toward?
We need to have more transparency. Everybody who works inside healthcare knows that there's a lot of variation in quality and cost of care, but patients don't necessarily either know that or have the tools to make smart choices when they could do so. Mm-hmm. So we've just seen a new national survey of American doctors that we've published, in which 59% of US physicians say that there are meaningful differences in the quality of care being provided by doctors in their local area. 59% of doctors themselves say there are these big quality differences. But if you ask the public, do you think there are? Only 44% of people believe that to be the case. So that 15 percentage point difference, if you like, between what doctors know and what their patients see is the transparency gap. And it's that transparency gap that is the first thing that we've got to tackle by getting a lot more open with the data so that health professionals themselves can see how they're doing and can use it to help improve, and so that patients can make good choices about how they themselves get treated.
Can you give us sort of a real-life example of how that would work?
UnitedHealth has now profiled just under 250,000 physicians across the country in 21 medical specialties, and those range from primary care, cardiology, orthopedics. What we've then done is looked at the performance of those 250,000 doctors against the national quality standards that the medical specialty societies themselves have set and other evidence-based guidelines. So the first kind of practical thing is to make that information available to patients at the time they are making choices about their healthcare.